Could another COVID booster shot be on the way? Well, FDA advisors are now recommending updated COVID-19 booster shots, specifically targeting forms of the Omicron variant for the fall. This comes shortly after the FDA authorized Pfizer and Moderna shots for children as young as 6 months old. Joining us to help make sense of it all is former United States Surgeon General under President Trump and Executive Director of Health Equity Initiatives, Dr. Jerome Adams. Doctor, good to see you as always, and thanks so much for coming on for our viewers this morning. Talk to me about.
Good morning.
Good morning to you. Talk to me about the boosters. It seems to be a continual rollout, but if I read this correctly, and again, correct me if I'm wrong, it seems as if the flu shot, just like the flu shot continues to get updated each and every fall, each and every year as it does mutate. Is this what we're seeing with COVID?
Well, I think you're actually looking at it the right way. It's important for people to understand we've had 2 updates in our flu vaccines more recently than we've had an update in our COVID vaccine. And we're on the umpteenth version of variants that are out there now. BA.5 is now becoming the dominant variant in the United States. So in all honesty, we should have updated these vaccines a while ago. What we know is they're still incredibly effective at preventing hospitalization and death, which is why the FDA has been hesitant to shift. But now with the rise of Omicron, the rise of BA.4 and BA.5, the FDA has decided, hey, we need to update these vaccines just as we do for flu. And what I tell people is we do need to get into a groove just like we do with the flu shot. Get your 3 doses of vaccine. It always should have been a 3-dose series described as such. And then we need to get into once-a-year updates. And we know that will protect people while also allowing us to keep the economy open.
Also, monkeypox. I wanted to ask you about that, as that made headlines as well. Yet another vaccine there being called for by the Biden administration here, ramping up the vaccination production, demanding increases here. Reported from Politico, citing cities saying demand for vaccines still outstripping supply. We've seen monkeypox in the headlines. The pictures are ugly. They're scary. And we've heard the stories of it. I'm just curious to hear your thoughts of if you have something to maybe quell some of the fears about monkeypox here on the broadcast, as many are seeking the vaccine and they can do for monkeypox, and obviously that is something they can do. It is accessible to them. The Biden administration is trying to get more out there, but should there be a major concern about monkeypox?
We should be aware of monkeypox. We should follow it closely. We don't want to repeat the same mistakes we made with COVID. And if we go back to 2020, we downplayed the severity of COVID. We didn't understand that we were in an exponential growth phase. We are, in fact, in an exponential growth phase of monkeypox. 300 cases in the United States, but probably many more because it has a 2-week incubation period that we are not seeing. The good news is we already have a vaccine. So we're not starting from where we were with COVID without a vaccine. We already know, at least right now, who is at higher risk. We know that men who have sex with men are the community that is being mostly impacted right now. But we know that this can impact anyone who has close personal contact with someone else. So we don't want this to spread further than what it has to. So that's why the Biden administration put out their big announcement just yesterday about their new response, where they're going to increase testing. Remember, with COVID, we had such a problem with testing. In the beginning. It was centralized at the CDC. The Biden administration did the same thing with monkeypox, but now they're shifting more testing out to the community. They're pushing vaccines out to at-risk communities. To your viewers, I would just say, follow this, be aware of it. If you have symptoms, flu-like symptoms, but with monkeypox, particularly your lymph nodes, under your armpits and your neck, those areas, if you have swelling there and you've been exposed to someone who's had monkeypox, then make sure you talk to your doctor, because you can get vaccinated to prevent progression of that disease, and you can get treatment if you get it.
I want to switch now to a very controversial, heated topic, Roe v. Wade overturning, right? Not necessarily the political ramifications with it, but just from a health perspective on the abortion of babies, the care of women. What are your thoughts on this, in this being reversed? Because there is so much messaging out there, some of it true and some of it not so true. Talk to me about that.
Exactly. No, thank you for the opportunity. There are legal parts to this, there are political parts to this, and there are medical parts to this. I'm a doctor. I want people to know that abortion is simply the loss of a pregnancy. And when you look at that medical definition, and I share this with her permission, my wife, by the medical definition, has actually had 2 abortions. She had a spontaneous abortion where she lost a pregnancy, and that was heartbreaking to us. And we would never want a woman in that situation where she just had a miscarriage to feel like she can't talk to her doctor or her doctor can't talk to her. My wife also had an ectopic pregnancy that would have killed her if she'd gone to full term. And so that's another situation where we don't want to criminalize or put stigma against the patient-doctor relationship. That's important no matter which side of this debate that you're on. Number 2, from a public health standpoint, we know that actually laws that limit the availability of legal abortions don't lower abortions. That's statistically true. What they do is increase illegal abortions. What lowers abortions is actually lowering unwanted pregnancies. So to everyone out there who's against abortion, and I don't want anyone to have an abortion. I don't want a woman to have to make that horrible decision. I say, what are we going to do to promote women's health? What are we going to do in the community to lower the number of unwanted pregnancies that women have? That's the real public health way that you lower abortions. And that's what I'd like to see more discussion about, not this horrible downstream choice, but giving women more upstream choices to be able to make healthy decisions. Education, more funding for job training, lower violence in communities. These are the things we should be focusing on to lower the number of abortions. And I hope the conversation moves there and not just on the Supreme Court decision about, again, this horrible downstream decision that some women have to make.
That is former United States Surgeon General Dr. Jerome Adams joining us live here. Doctor, good to see you. Thanks so much for coming on.
Always. Thank you so much.
You got